Hi everyone, my name is Chelsea Cartwright and I'm a part of the group called PPE Watch. In this group we have Cielita Allen, Sydney Kuiper, Amber Foy, and myself. Cielita oversaw the research and completed the bibliography. Sydney and Amber completed the PowerPoint, and I am editing, producing, and narrating this video. The topic of the presentation is the importance of PPE safety. PPE is the abbreviated term for personal protective equipment. PPE is used when there is a risk for contact with contaminated chemicals or body fluids. PPE is extremely important because it minimizes potential exposure to infective agents and materials, thereby providing protection to both healthcare workers and patients. There is evidence to show that failure to use PPE has led to an increased risk of infection. For example, in one instance of an outbreak of severe acute respiratory syndrome, the infected staff had omitted either correct PPE or correct hand hygiene. The components of PPE include gowns, masks, goggles, shoe covers, and gloves. There are different styles and designs of masks and goggles depending on the task or what infection it is. There are also sterile gloves and non-sterile gloves depending on the task being performed. In the hospital, there are patients that have different types of infections that require precautions. These precautions are wearing different PPE. There are 4 different types of precautions. One of those types is contact precautions. There are actually 2 types of contact precautions. Regular contact precautions, you just have to wear a gown and gloves and make sure to sanitize your hands after the patient contact. Contact spore precautions are specifically for Clostridium difficile patients, and you have to wash your hands after any contact with C. diff patients. Another precaution is airborne precautions, and you will see patients with tuberculosis or possible tuberculosis, and they will have these precautions. You have to wear a N95 mask for this patient. And then after patient contact, you have to sanitize your hands at least. Then there are neutropenic precautions. And with these patients, they are very immunocompromised. So you have to wear a face mask. You have to sanitize your hands before contact with the patient or wash them. And you cannot have any live plants or flowers in the room. If you yourself have an infection, you are not to enter because these patients can get that infection very easily. If you have a patient that has another kind of infection that's on precautions, you cannot also have a neutropenic patient because there is a chance for the cross-contamination. And finally, droplet precautions. Droplet precautions are most of the time patients that are coughing up and their sputum is infected with something. So you just have to wear a mask and you have to make sure to sanitize your hands after. If I were you, I'd wear gloves too, because you don't know where they've coughed and what is in their sputum or their pee or anything. You don't know where it's at either. So I'd wear gloves too. And now she's going to take everything off. And here she is, sanitizing her hands again. The biggest problem with personal protective equipment is non-compliance. Different factors influencing non-compliance include workload and stress, perceived lack of time available, shortage of PPE, lack of knowledge or training, inappropriate or no policies on the application, use, and removal of PPE. Decreased dexterity due to PPE, reports that glove use interfered with nurses' ability to provide care, and the perception that PPE interfered with their duties. To sum up, low compliance with PPE use and its incorrect handling derives from factors like discomfort, inconvenience, carelessness, forgetfulness, lack of habit, equipment inadequacy, insufficient quantity, and disbelief in its use. What can an organization do to increase the compliance with the required PPE? Possibly offer extended education, offer incentives, make it part of the hourly charting as a safety check, just like we check to make sure the call light's there. Make cheat sheets for when PPE needs to be used. Label or color code where PPE should be discarded after use. To conclude with this presentation, personal protective equipment is important in healthcare, but it is often not complied with. This is due to the perceived inconvenience, discomfort, education, and insufficient quantity. To promote compliance, participation in education of PPE should be required. I've been non-compliant with PPE before. The main reason for my non-compliance was lack of time and discomfort. For example, I had a patient with Clostridium difficile. This is a contact precaution patient, therefore requiring gloves and a gown. I went in to perform a quick assessment on this patient and I only put on gloves. I thought, hey, I'm not going to be all up in their stuff or anything like that, so I'm just going to put on gloves and I'll be just fine. I should have put on the gown because really you end up touching the patient with your body more than you think you do. Hello.
Hello.
Nice to see you. My name is Chelsea. I'm going to be your nurse today. I gotta put a gown on, so just bear with me. How is your pain?
It's an 8.
It's an 8? Have you been having any shortness of breath?
Yes.
Okay. I'm going to take a look at your legs and your feet. Okay. So to the students watching this video, do you have any suggestions that could help with the compliance of PPE? Have you yourself had an experience with non-compliance? And why were you non-compliant? Visit the discussion board and let us know. Thank you guys for watching and have a great day.